Hello and welcome back to the PJ Pod. In this Spotlight episode, we'll be discussing the availability of palliative and end-of-life care services. Last year, the Health and Social Care Select Committee conducted a review of these services as part of an inquiry into assisted dying, and ultimately concluded that their provision was patchy for patients across the UK. At the time, the committee called on the government to ensure universal coverage of palliative and end-of-life services, which will be more important than ever if the NHS is to meet the rising demand for such services in years to come. This month, we published a feature by David Lepanovich looking at what the availability of palliative care services is like at the moment, and what needs to happen next for access to improve. I'm Carolyn Wickware, Executive Editor at the Pharmaceutical Journal, and I'm joined by Senior Features Editor Dawn Connelly to discuss what the feature revealed. Hi, Dawn.
Hi, Carolyn.
Just briefly, what are palliative and end-of-life care services? Are they one and the same?
Yeah, they're similar, but not quite the same. So palliative care is specialised medical care to improve the quality of life for patients with a serious illness and to provide support for their families. And this includes end-of-life care, which is more specific to people who are in their last year of life.
Right, okay. And what is the current demand for palliative care services right now?
Well, according to the cancer charity Curie, around 90% of people who die in the UK would benefit from receiving palliative care. And if our trajectory towards an ageing population continues, it's predicted that over the next 25 years, there'll be a 25% increase in the number of people who need palliative care. This means that in 2048, more than 730,000 people would die with palliative care needs.
Wow. All right, sticking with the current situation just for now, how are patients accessing these services at the moment?
It's actually quite the process. So for a patient or their families to access palliative care medicines, there are 4 main steps to go through. First, you need someone to assess what medicines a patient needs. Then someone has to prescribe these medicines. Then someone has to dispense them. And finally, someone has to administer them promptly when they're needed. As you can imagine, coordinating all of this can be incredibly challenging for patients and their families, particularly late at night and during weekends. Sadly, a breakdown in any one of these steps can cause delays to a patient receiving their medicines, which can obviously be really distressing.
And based on what we know from the committee's report that I mentioned earlier, I'm guessing these services aren't keeping up with demand, right? What's making access difficult?
Yeah, that's right. So when it comes to pharmacy, there are a few key challenges that make access to palliative care medicines difficult. So for one, there aren't many community pharmacies that are open after hours and on weekends, something that's been compounded by the increasing number of community pharmacy closures in recent years. And the other issue is that not all pharmacies stock these critical palliative care medicines, as they're expensive, and if they expire before they're dispensed, then pharmacies are left with the cost. Outside of pharmacy, another big challenge is access to district nursing. So district nurses are required to administer palliative care medicines, but of course they're also responsible for numerous other tasks and services, often across wide geographical areas, so when they're at capacity, it's more difficult to get timely access to palliative care medicines.
So demand is set to increase, but palliative care services are already struggling. What is going on at a national level to improve access to this care and the required medicine?
So in 2022, NHS England began incentivising pharmacies around palliative and end-of-life care medicines for the first time as part of the Pharmacy Quality Scheme, which was continued for the 2023-24 financial year. The aim was to encourage some consistency in access to palliative care medicines across the country by paying community pharmacies to either stock 16 critical palliative care medicines or to provide an action plan for patients to access these medicines if they don't stock them. But Dave Lepanovich, who wrote this feature, sent a Freedom of Information request to NHS England asking what proportion of pharmacies met these palliative and end-of-life care requirements in 2023-24, and he discovered that only 47% of pharmacies in England routinely stocked these medicines.
So the committee was right to describe access as patchy then?
Yeah, that's right.
So that was for the 2023 Pharmacy Quality Scheme, or PQS. What does that mean for the current offering from community pharmacies in 2024-25? Are all those pharmacies still holding those 16 drugs?
So at the moment, there is no active PQS for 2024-25. Whether there'll even be a PQS at all is subject to contract negotiations between Community Pharmacy England and the government, which are currently on hold following last year's change in government. These are due to restart at any moment. So it's unclear how many pharmacies still stock these medicines. But many ICBs are actually running their own local palliative care services.
What's the benefit of having a local service over a national scheme?
So locally commissioned services are much more tailored. For example, in Bedfordshire, Luton and Milton Keynes ICB, they've got their own list of palliative care medicines for high turnover pharmacies to stock, which better reflects usage locally and reduces medicines waste. Many ICBs have commissioned local services across the country. According to Community Pharmacy England's local service database, there were 114 locally commissioned palliative care services in England at the end of last year.
So the national scheme aimed to reduce variation in services while the local service encouraged tailored care. Is there a happy medium there?
Yeah, I suppose there'll always be benefits and limitations to both. One way to overcome stock issues or access to medicines, particularly out of hours, is through anticipatory prescribing. In the UK, standard anticipatory prescribing, also known as just-in-case prescribing, mainly involves 4 injectable medicines to treat symptoms of pain, nausea and vomiting, agitation, and noisy respiratory tract secretions. As the name suggests, prescribing these medicines in anticipation for their potential use means patients and families are better prepared. It also gives pharmacists more time to get stock and dispense these medicines.
What role do pharmacists have in anticipatory prescribing?
As more pharmacists become independent prescribers, those who specialise in palliative care will be able to prescribe these medicines and hopefully improve overall access to the service.
And at a national level, what's being proposed to improve palliative care?
So when Dave, who, as I said, wrote this feature, spoke with Sarah Cox, a palliative care consultant and president of the Association for Palliative Medicine of Great Britain and Ireland, she mentioned the benefit of a single point of access for all palliative care services. So having a single number which can provide information on district nursing, pharmacy, hospice, GPs, etc., and deliver a coordinated service. This approach is being piloted in some areas, but at present it's unclear whether the Department of Health and Social Care or NHS England are working towards anything bold like this as part of NHS England's 10-year health plan, which is due to be published this spring. The Health and Social Care Committee has also just announced that it will be conducting an independent evaluation of the state of palliative care in England.
Another one?
Yeah, we did start off by talking about a Health and Social Care Committee review, didn't we? But this one's specifically focusing on palliative care.
Right, okay. Thank you, Dawn, for taking the time to explain all of this. We'll wrap it up there for now, but you can read the full feature at the link in our show notes.
Great, thanks, Carolyn.
This episode of the PJ Pod is part of our January issue. The PJ Pod is brought to you by the Pharmaceutical Journal, the official journal of the Royal Pharmaceutical Society. And just before I let you go, if you're interested in joining the Royal Pharmaceutical Society to access a range of member benefits, including the Pharmaceutical Journal's news, features, and learning resources, you can do so for the equivalent of just 60p a day. Just search RPS membership to find out more. Thanks for listening. Bye.
Bye-bye.